I don't think I have to tell anybody who's here in this room that California, really our entire country, is faced with a major health epidemic, and it costs billions of dollars a year in hospitalization costs, and this is an epidemic that affects people of all ages, ethnicities, and backgrounds. But what I'd like you to be thinking about today is not the dollar cost of this epidemic, but how it affects individuals and families. Diabetes is the 7th leading cause of death in America, but it also dramatically increases the risk of developing the first leading cause of death, and that's heart disease. So you see how interrelated these things are. Diabetes was once a disease that was primarily reserved for adults, but it is now rapidly affecting our youth. Studies have shown that the number of people diagnosed with diabetes in California has jumped 50% between 2001 and 2012. Type 2 diabetes is preventable, yet if current trends do not change, 1 in 3 children, that's 1 in 3 children born in California after 2000 will be diagnosed in their lifetime. The rates are even higher for Latino and African American kids, with projections showing that 1 in 2 would develop the disease. So what are we doing to address this health crisis? The answer is not nearly enough. California has fallen behind, spending the least on diabetes prevention of any state in the nation. Let me repeat that. We are spending the least on diabetes prevention of any state in the country. In fact, according to a recent state auditor report released in January, California has no state funds, 0, dedicated to diabetes prevention. And I think it goes without saying that this is unacceptable and something that must change.
The evidence is indisputable. Sugar-sweetened beverages increase the risk of obesity, diabetes, and tooth decay. I see this every day I go to work, and we are drowning in sugar.
While I'm here in the capacity of my American Heart Association title, that is not the only title that defines me. I'm a dad. I have 2 young daughters. As you heard, 1/3 of children born after the year 2000 and half of Latino and African American children will be afflicted with type 2 diabetes at some point in their lifetime. I see firsthand how soda companies target our youth. So anything that I can do to help reverse the trends and make sure that our kids are given a fighting chance, I'm for that. I'm a son and I'm a nephew. I have to look no further than my own family and my own community to see the impact of diabetes, heart disease, and obesity. You don't have to tell me that diabetes has become an epidemic. I see it in my neighbor who recently had his leg amputated. Many of these circumstances are preventable, but so many in our community see them as inevitable. The opposition will tell you a lot of things about AB 1357, but what they won't tell you is that we can't afford the billions of dollars that chronic conditions related to sugary drink consumption cost California. And the beauty of AB 1357 is that the revenues raised from the fee will go directly to communities that are disproportionately affected by the chronic diseases that are brought on, in part, by sugary drink consumption.
AB 1357 will create a funding source to tackle the issues of childhood obesity and diabetes through holistic community and school programs. Sugar-sweetened beverages are the largest source of sugar in the American diet. Sugar-sweetened beverages, therefore, are one of the leading causes of diabetes. Overconsumption of these beverages has been linked over and over and over again with obesity, diabetes, tooth decay, and heart disease.